patient came to us with the heel socket, and it was due to a failed root canal. Okay, so you can never match the central incisors. Whatever the most expensive zirconia crown you use, you cannot match the central incisor. You're going to do a cap on it. Canine, you cannot match the contours. Okay, and 6 is your cornerstone. It's where you're going to have the most biting force. Go to put a crown on that, it's going to work for long. Okay, so try to avoid these areas. So this is something that we do, right? When patient comes to your clinic with some issue, okay, we'll think, right? What are the questions we can ask? You want the night sugar நான் ஏதாவது கேள்வி ஏதாவது ஒன்று வந்து ஆமாம் சார் அதனால தான் சார் பண்ணிட்டேன் இன்னும் நம்ம எஸ்கேப் ரைட் this is something we commonly do, right? Okay, in implantology there are two complications you cannot escape from. Okay, one is paresthesia in basic implantology. Second, zygomatic going into the eye. Okay, இது ரெண்டுமே வந்து உள்ளலாம் போகுது கொஞ்சம் லைட்டை தொட்டுட்டு இருக்கும். So these two things are purely surgical. It's in your hands. நீங்க வந்து என்ன கேள்வி கேட்டாலும் நீங்க தான் பண்ணுவீங்க. Okay, and that is why again people are scared. You numbness, these are basic things. So like CBCT is there. You measure properly. You see everything clearly. Use a short implant. Don't be heroic. No, if suppose there are some missing files there, you have metal foramen, avoid implants. No problem. If you think your implant is going to be, you have no other way, avoid implants. Okay, stay away from the nerve at all cost. Paresthesia you cannot escape from at all. நீங்க என்ன கதை சொன்னாலும் வந்து இந்த டாக்டர் முதல்ல இல்லை இப்போ தான் இருக்கு அப்போ என்ன காரணம் இம்ப்ளான்ட் யார் போட நீங்கள் தான் போடுவீங்க. Okay, and of course zygomatic also because of only purely orientation. You cannot have any excuses on that. Okay, everything else, implant can go into sinus, you can retrieve it. Implant might fail, you can retrieve it. You can say sugar had happened, you were smoking, or you can say find fault in the patient or could you can go away, get away with it. Okay, but paresthesia never. Okay, good. So we'll see some cases how we are going to equip ourselves and what are the cases that we are going to do as implants. Okay, so I'm going to show just some cases that see we have to be prepared to manage all kinds of cases. I cannot say this case I will do, this case I will not do. Start somewhere, but along the journey you keep training yourself better and better that you manage more cases. Okay, so extraction immediate implants. This is something that as I told you, it's good for the patient also because it becomes a single surgical procedure. Extraction, placement becomes a 2 surgical procedures also. So you can see here 4 implants placed, okay, and with good stability position, and we also lower also. These are SS retainers, one kind of temporization procedures. SS retainers, wait for 6 months, then go for the next procedure. Okay, again when we have young female, okay, see missing teeth over here, these 2 canines are mobile. Okay, period case again, right? So what we did, we went for extraction of the canines, they are mobile, alright, and then went for implant placement. You always check for bone in the drill. So implant placement here, and then implants placed over there, and these are immediate fixed CAD/CAM acrylic dentures. Immediate fixed CAD/CAM acrylic dentures, screw retain processes. Okay, and then after 1 month you go for the permanent process. No need to wait for 6 months because they have the anterior teeth. After 1 month you go for the permanent process. Impressions, and you can see the cup, correct? See, this is the emergence profile. See, good emergence profile on all the 4 implants. Acial zone again a challenge. Huh? So we are removing the temporary teeth, fixed teeth. That's profile again. And these are the final process. Here's the young, beautiful female, age 31 if I'm right, and that's the final process. She's on them for now past 4 years now. So these kind kind of aesthetics is very difficult to get with your bridges. Very difficult to get such kind of aesthetics, such a comfort with your bridges. Okay. So now, can we do placement also in infected sites? Yes. So that, as I can say is that every case we can attempt and do. It's not impossible. You can see here we have section socket, single premolar. There is a cyst over here. There's an infection over there. Okay. Provided we have some native bone to engage. We need some native bone to engage. Last raised. Okay. You can see we are relieving the fistula. You can see the critical infection there. You can see this infection over there. So clear the infection nicely, do a betadine wash, and then just go ahead with the implant placement. Yeah, so implant placed with grafting. So what you saw in these three cases, where see, extraction also you can do implants, infected socket also you can do implants. Okay, you can do immediate loading also, you can do temporization also. So there are multiple combinations of options you can give to the patient depending on their need, not what you do, what you can do. There will be patients who say, doctor, I'll get a denture, no problem. There are some people who say, I don't want any teeth, I'll go for permanent teeth. No, I don't mind. Some people don't, even for one hour I can't be without teeth. No? Patients will come with different kind of requirements depending on their profession, their aesthetic requirement, their needs, right? So you have to adapt according to their needs, whatever options you can give, right? Right. So what next? What are the other options things to do? This is a full mouth rehab. Now we saw extraction placement, we saw single implant placement. What else is there in implantology? So this is one of the oldest cases. She's a school correspondent. She's a owner of a big school. She had dentition like this, all teeth mobile. Okay. So total extraction done and implants placed. We call this is my oldest case. So next case is busy. Nowadays I don't do this. Alright. And we went in for open tray impressions, metal trial, and good. See, this has been in place for so long. Ceramic restoration. Okay. So imagine how there's a change in smile, change in confidence, the smell that imagine being a teacher talking to students like this with all that. These things are okay. And how it has been life changing for the patient. Okay. Now the era of tilted implants. Those are straight implants. Now lot of research, lot of success going on with tilted implants, right? Tilted implants, all on 4, all on 6, zygomatic implants. Why? Because again, as I told you, time. Now there is no waiting period for tilted implants because now these concepts are biomechanical principles, engineering principles which enable immediate loading. Patient will come to you from Australia, sit in your practice, extraction, placement, impression, loading, fixed process. They will go back within 5 to 7 days. Okay, it's now happening multiple clinics in Chennai. I'm not saying I'm the only one doing it. A lot of clinics now, a lot of centers now doing full mouth rehabs with tilted implants. Yeah. And then so then they come to your clinic saying that suppose you haven't practiced in suppose ma'am's clinic is there. So now என்ன எதுக்கு வந்திருக்கீங்க implant நான் போடணும். So implant போட்டுட்டு எப்போ பல் கொடுப்பீங்க ஒரு 6 மாசம் கழிச்சு. Then sir clinic போறாங்க. They'll go right. They'll go to 3-4 clinics. They won't agree with one person, even if they're very close also. So implant போடணும் ஒரு வாரத்தை பல்லு கொடுத்துரும். What they will choose? What they will choose? They will choose immediate loading, and unless they have some crazy ideas. Okay. So time again becomes a very important factor. Okay. So this is what all-on-4 looks like. This is what all-on-4 looks like. Okay. So when you do these all-on-4s, when you go for the full mouth rehabs, you're going to give the patient teeth on the same day. You have chair side temporization. Anneke vandu nam denture fixer convert panni kuduthiralam. So you have immediate chair side temporization also. Okay. So this is immediate denture conversion. Mandible again. So once all this is done, okay. So this is the patient on the same day. Patient is edentulous, coming to you, dentulous on the same day. And the smile they give you will be a very confident smile. They will surprise also that now, because imagine them coming with drooping lips and everything. Now when they come, they're all set now, right? So they're also happy with you. They're doing what they will do, they will go back, refer more patients. They're going to tell their family, they're going to go to a wedding. So you're going to get word of mouth publicity also is going to be very good thing to do for this. And then finally, zygomatic. This is my first case of zygomatic. Okay, 12 years back, right? And see again, now these patients are not going to come with onco cases or not trauma cases like that. This patient was my neighbor from my church, like three streets down. After I finished my zygomatic training, then people tell me, when will I get my first zygoma case? This is a perio case. It was edentulous because of periodontal disease, right? So when we train ourselves, when we get knowledge, we will start looking at cases differently. Without knowledge, we look at in different perspective. When we have these things in our head, we will start looking at it in a different perspective. Okay, these are options available. Okay, once you are confident, we will tell the patients how this can be done. Okay, this is zygomatic implant. Okay. So 3 implants in the premaxilla and 2 zygomatic implants. So this is where the name came. This was my first Facebook post, Implantology Anywhere. I told Raj he made implant anywhere, leaving the ology. Okay. And that's the process. Looks like the patient is still good. When I go to church, I see him sitting with 3 chairs in front. Okay, he's not saying anything, so I assume he is fine. Okay. So right. So now because of these, now why I'm talking about full mouth implants? See, even single implants are life changing, but when you have full mouth implants, you are doing something very noble to the patient. Okay. Now we do full mouth implants even for patients who are 82. I did full mouth implants for patients 92. A captain. He was a retired army captain. 92. Because I came to see overdentures. Right. I do all this, but then see now age is not a factor. You know what happens is the general middle class like us, they will keep on earning and பொண்ணு கல்யாணம் பண்ணணும், பேத்தி ஸ்கூல்ல சேர்க்க எல்லாம் முடிச்சிட்டு ஒரு 60 வயசுல வந்து நம்மளை பத்தி யோசிக்கிறோம். அப்போ அந்த காசுல என்ன பண்ணலாம்? Will spend on us. Dentures, fixed teeth or an investment, they want a luxury they give to themselves. நிறைய பேர் நீங்க பென்ஷன் காசுல என்ன பண்ணுவாங்கன்னா பல் கட்ட வருவாங்க. We have patients like that. I don't know if you have experienced that. Okay? Because now they want to start eating nicely, they want to chew nicely, they want to live a good lifestyle. Correct? And what gives that? Fixed teeth. Fixed teeth. I've had educated patients who are like living on mobile teeth for the last 3-4 years. One, non-affordability. Second, fear, bio. So when he gives such kind of options, see this is one of my favorite cases. She was a female, 15 years on dentures. She was a CEO of a very big IT company. 14 years on dentures, for dentures. Okay. So we are going to go do her zygomatic. She had gone to multiple clinics where they told implants cannot be done because bone were very less, or grafting which doesn't have good success rates. Okay. So now problem is she had gone to multiple clinics. They had not told her about this treatment. Why? They didn't know, and they are not confident about it. Suppose if they refer to me, something goes wrong. What will happen? நீங்க தான் அனுப்பிச்சீங்க, ஏன் இப்படி பண்ணி கேட்பாங்கல்ல. So they are also not confident of the procedure. They are not aware of the procedure. Like ourselves I'm talking about. So once we develop knowledge and confidence about these things, you will start referring patients. You will also start getting people to do it in your clinic. See, zygomatic implant வந்து ஒரு தியேட்டர்லாம் தேவை கிடையாது. உங்க சேர் ஒரு சிங்கிள் சேர் 400 ஸ்கொயர் ஃபீட் அங்கேயே பண்ணலாம். Okay, it's not a big renowned procedure. Okay, right. So this is the patient, and she was 15 years on a denture, but she had an immediate process in a week. Yeah. So imagine, she asked me, yes sir, yarume endu sollala. This is the question she asked me. Okay, yes sir, yarume endu sollala அப்படினு. Right. That's the smile she had after that. I'm supposed to cover her eyes. It's okay. Alright. So the implantology by itself, I'm not saying zygomatic is the end. Even a good grafting case is a task. A good Corey's technique is difficult. We have block graft is difficult. I'm saying there's so much options to manage any kind of case that comes to you, right? So this is again a patient from UK. Okay, extract socket. Implants, dentures, all hybrid applique process. Okay, so full mouth rehabs. Wanted a picture, sorry. So take. And this again, patient, it's not like patients will come to you at 50, 16 years old. He was a 21-year-old spinal patient. 21 வயசு எல்லா பல்லும் ஆடிக்கிட்டு, ரைட் ஃப்ரம் 18 எல்லா பல்லும் ஆடிக்கிட்டு, பேட் ஸ்மெல், வேலை கிடைக்கல. Blood test, we had some blood discretions also. Patient came from Tiruvannamalai. Okay, blood discretions also. Then we had to refer him back to his physician, get it all sorted out. Then he came back to us, all teeth extracted. Okay, I kept his molars, I think. Yeah, these molars I kept. They were good. You know, it always. So you don't have to do total extraction all the time. அவங்களுக்கு ஒரு பல் இருந்தால் சந்தோஷப்படுவாங்க. நம்ம பல் ஒரு பல்லாக இருக்கே. Okay, so we removed all those teeth and lower we went for basal implants over here. 21-year-old patient. He's doing fine. I think the last 4 years is on our follow-up. Okay, acrylic hybrids. Okay, so what I tried to do is show you an entire horizon of possibilities in implant practice. Correct? You've seen single implants, extraction placement, pulmonary rehabs. Okay, I didn't show you grafting and all because that will stretch too much. So we have to invest first in you. Of course, we don't have a lot of money in the bank to invest. Okay, you can ask your parents, in-laws, take loans. Okay, my first physio dispenser was an implant center. It was 4.5 lakhs in 2012. Because it has a piezo machine and a physio on the same machine. Now same machine is 9 lakhs now. So Jaipur conference, I took a loan, 6 lakhs, 7 lakhs loan. Physio kit, life care kit, life care implants was there. So it's okay. But then once you invest, I'm sure you're going to reap the benefits. This is a sure shot. I'm in the business invest in a cost because why? Because this is not just money. You're not going to value because now you are going to become a better dentist. You're going to become more acute dentist. You're going to handle more number of patients. You're going to handle more number of cases. And this is a specialty practice which you can do at your level. You don't need extraordinary training to do it. And what those patients are going to do, they are going to refer to you more patients. Once you start doing implants, some basic implants, then you will become known as a implant center. In the clinic, doctor, because patients come to your clinic for your face only. Face what I am a brand for my practice. My practice is Dr. Johnson. And I want the case, but first they want to see my face. So you are the brand for your clinic. You have to develop you as a brand, correct? So invest and then, of course, this is sure of success. Failure once you start doing implants in your practice, it's going to be sure. I'll just show you this last case. So 15 is my time. Okay, how a case can be treated differently, scientifically, ethically. Now, see this patient now. What is wrong? Everything's wrong. Okay, very poor smile. Like the patient, what can be done for the patient? Then fine. Enga camera recording photo நான் பேசும்போது என்ன இன்னும் டீடைல் பண்ணலாம். தென் நான் சொல்லணும் உனக்கா வந்திருக்கேன்னு சொல்கிறேன், நீ உட்காந்து ஹோட்டல் ட்ரீட்மெண்ட் ஆப்ஷன்ஸ்